was needed. And today is also Wellness Wednesday. And we thought the best way to kick off the day was to talk about something that many of you might be talking about with your parents or your spouse. Medicare. Medicare enrollment has just opened up, and there is so much information that we wanted to keep you in the loop, and we have some expert advice here with us this morning.
And that's why we have Kathy Aquino here this morning. She is the Vice President of Sales for Medicare, Consumer and Small Business Markets at Independent Health. So thank you so much for being with us this morning.
Good morning.
I appreciate it.
So let's just start off by saying, okay, Medicare open enrollment is open right now.
Right.
So they have some time to get things sorted out, correct?
They do. They do. It goes very quickly, though.
It does go quickly.
The Medicare annual election period began October 15th, so this past Saturday. It runs through until December 7th. And it's so important because it's that one time a year that Medicare beneficiaries have the opportunity to make a change in the current plan they're enrolled in or enroll in a new plan for January 1st, 2023. But the good news is if they're happy in the plan that they're currently enrolled in, they'd have to do nothing at all. They'll automatically be enrolled into the plan for next year.
I know a lot of people have questions.
Yeah. Is there anything new that's being added?
Yeah. I think what Independent Health is providing into our plans for next year is very exciting. New for 2023, we have the PERS device, which is a personal emergency response service that's at no cost in select plans. We have an array of zero co-payments across our benefits, such as zero co-payments when they go visit their primary doctors, as well as Tier 1 medications, preventative services, dental, vision, as well as our gym membership. So it's all good news for next year.
Now, if folks have questions, because it is sometimes easier to just talk to somebody.
Yeah.
I know we try to Google our way out of everything, but if they want expert advice and somebody who really can walk them through the nitty-gritty, what should they do?
We encourage people to come visit our local red shirts at any one of our Medicare information centers. We have the most here in Western New York during this busy time, as well as walk-in locations. So that means bring a list of your prescriptions, list of your doctors, the hospitals you're going to use, and the labs. And basically at that one-on-one individual assessment, we're going to give you that red shirt benefit review and make sure you're enrolled in the right plan for next year.
I have a question. Do you need to sign up and get a reservation, or do you need to reserve a spot to talk to somebody?
We do have that as an option. Most people walk in because we are staffed with red shirts to be able to take those walk-in clients that come to visit us at any of our Medicare information centers. So you don't have to make an appointment. Some people like to have one, but we encourage them to just walk in.
Yeah. Kathy, what information are we missing?
Yeah.
What should people know?
I think for next year, for 2023, it's a great recognition for Independent Health, who's the largest Medicare Advantage plan still here in Western New York, is that 2 years in a row we've been recognized with a 5-star recognition. And what that means to the customers is that 2 years in a row, the Centers of Medicare and Medicaid Services gave us the highest score on their report card. For our HMO, PPO, and our PDP, or prescription drug plan. We were the only plan in the nation, as well as here in Western New York, to receive that recognition. And what it is, it's the highest recognition of quality that a plan can get from Medicare.
Okay, so since you are the experts, top tier, what is the number one question you get from folks when this time of year rolls around?
Yeah, it's usually kind of what happened this year. You know, what's going on with their prescriptions that their doctors may have put them on or taken them off, as well as what's pre-planned for next year. Do you have any surgeries coming up? Recognizing then you want to check that list of doctors in the hospital so when you go to use your plan, there's no surprises.
And what do you think is on the top of the list when it comes to recommending people do, other than don't wait?
Yeah. Oh, don't wait. Yeah. I think what we've seen the last couple of years, because it can become overwhelming.
Yes.
So we tell people, get in to see a red shirt now. Don't wait until the last minute, because December 7th, unfortunately, is going to come really quick, and we don't want people stressing out about, oh, I didn't get in to see a red shirt. Come in now. We're ready, and we're waiting for people to come in to do the red shirt benefit reviews.
Yeah.
Is there anything they need to bring with them?
A list of their prescriptions, list of their doctors, which most people know already. And then we do that benefit review, and we kind of line it up, and we'll say, yep, this probably looks like the best plan for you to be enrolling for next year.
Goodness.
And remind folks again where they can go to get more information.
Yep, they can go from Niagara County to the southern tier to City of Buffalo. We have our permanent Medicare information centers. If you can't get there, call us, 635-4900. Red shirts are standing by to do those red shirt reviews.
Love it. Kathy Aquino, thank you so much for being on AM Buffalo.
Thank you.
And on the other side of this break, goodness me.
A candid chat with 2 doctors about breast cancer and how to choose your practitioner. Stay with us. You are watching AM Buffalo.